Jillian Pryor, and I am the Assistant Director of Alumni Affairs on the communications team at the medical school. This lecture series aims to give you an opportunity to learn about and navigate different career paths in medicine, not simply academic. And this lecture, as well as future lectures, will also give you the opportunity to ask candid questions, and I definitely encourage you to do so. Take advantage of this time that we have with Dr. Alli and this unique networking opportunity. So today we are featuring Dr. Kemi Alli, who is the CEO of the Henry J. Austin Health Center in Trenton. She primarily serves patients living below 200% of the federal poverty level. Previously, she served for 7 years as chief medical officer and has been a pediatrician at the center for nearly 2 decades. So I am happy to turn it over to Dr. Alli. I encourage you to submit questions via the chat during this presentation, which will be answered afterward. But I also really encourage you to turn your videos on and ask questions after the presentation. You can either raise your hand or simply just turn your video on and ask questions. So without further ado, I'd like to introduce our alumni speaker.
Yes, good afternoon, everyone, and thank you for this invitation. I'll start off just telling you a little bit about myself, my history, and what I am doing right now, and how I came to be where I am, and then really open the floor up so that we can have dialogue and discussion. So I am Dr. Alli. I'm a pediatrician by training. I went to Rutgers University and then went to Robert Wood Johnson Medical School, and then went on to do my residency in pediatrics at Robert Wood Johnson as well. So I know the New Brunswick area very, very well. Spent almost 10 years learning and growing in New Brunswick. Once I came out of residency, I knew during my training that I wanted to work what's in what is called a community health center, which is where I work right now, a federally qualified health center. And so I really applied to all the community health centers in my area and was chosen to work at Henry J. Austin Health Center, which is located in Trenton, New Jersey. And I've been here ever since, going on 24 years now. So sort of what led me down the path. I've got an interesting beginning, and it's not a cool story. You know, there are some stories where people were inspired to go into medicine. My story really isn't like that. So when I was in college, I had a roommate who was always studying. And I was like, why are you always studying? Like, let's go do something. She's like, no, I want to go to medical school. I was like, what is that? You know, so really, I didn't come from a background of medicine. I didn't have a lot of family members. I didn't have any family members that were physicians or in the medical field. And as she told me about it, it really inspired me to say that is something I could possibly be, because I always liked biology, I liked math. And so I applied. I went to medical school. So again, pretty fortuitous. Me and my college roommate, we're still best friends today. We're both pediatricians. And then once in medical school, you know, you have lots of choices, right? So, you know, you do your didactics the first 2 years, and then, you know, you do all kinds of rotations in the second 2 years. Again, my decision to go into pediatrics was pretty pragmatic. You know, I realized really quickly that not only did I enjoy working with children, you know, just their true innocence, you know, they're happy to see you, they'll let you know. If they're not happy to see you, they'll let you know. With adults, it's always different, right? There's this hidden agenda. You never know if they're saying what they really mean, if they mean what they're really saying. And so again, I really gravitated to pediatrics, loving to work with children. Now, to be in pediatrics, you gotta not mind the crying. There's a lot of crying that goes on in pediatrics. In fact, at this point, I sort of tune out the crying. It's kind of like a white noise in the background. So I was with someone the other day in my office, and they were asking, how do you deal with all the crying? Because there's kids crying, they're scared, they're nervous. I'm like, what crying? He's like, don't you hear that in the background? I'm like, no, I don't hear it anymore. So you really have to be comfortable with that. But otherwise, again, I really enjoy the honesty and purity that comes with working with children, and how you actually have an opportunity to shape the lives of the individuals that you work with. Then someone asked me, well, how did I get into being into administration? So I practiced at the same health center I'm at today for about 10 years. I was on the front line, seeing patients every day, and always had a thought that things could be better. We could make it better. Like, how do I make this better? And so then I started, writing policies to make things better, or changing a form to make things better. And then I understood there's a whole profession of physicians who do administration, which I never realized. So that there are physicians who work in research, there are physicians who work in academia, there are physicians that do administration in hospitals and ambulatory care centers. And that really opened my eyes to the possibility that through my skills, not only could I help affect or change the life of one person at a time, but through policies and regulations, I can change the lives of many people at one time. And that, I was really drawn to that sense of making systems better. So my first career was about helping each individual pediatric patient and their family, and hopefully helping to improve the quality of their life through my interaction with them. And through administration, I then realized, well, now I could do this as a chief medical officer for 10,000 people by the policies that I set, by the regulations that are created. And then as CEO, that further expanded, particularly for health centers, because then you can be part of movements across the state in terms of setting regulations, being a part of committees, being a part of panels, being a part of advisory groups, again, that set the tone, set the regulations for the services that hundreds and thousands of individuals receive across our state. And so again, that notion of how can my institution really help improve the lives of the largest majority of people as we possibly can. I'm always struck, having driven through the back streets of Trenton, which I do often because I'm very impatient. So I don't like waiting at lights. So I often drive through the back streets where there are no lights. And I'm struck by the sheer level of disparities that I see between where I live and where I work. And always constantly thinking, what is my role in making this better? What is my role in helping to improve the life of the individuals that walk through the doors of my health center? And I think that's important for me personally, because I believe that we are who we are in life, a lot by circumstance. So very easily, I could have been born in a different country at a different time. But I am who I am today. And I have certain privileges, I have a certain authority, and I don't take that for granted. For those of you who are a Marvel fan, right? It was said to Spider-Man, with great power comes great responsibility, right? And I really believe that I am who I am by circumstance, and therefore I have a sense of purpose, a sense of responsibility to really help improve the lives, as many lives as I possibly can, because I very easily could have been someone different. I could have been doing something different. I could have been born in a different place. And that sort of led me to this journey of where I am today, and how I'm always looking to make things better. And, after so many years, really understanding that the way we make things better in this country really is tied to policy, really is tied to regulations. And as in the media right now, right, really is tied to voting and and exercising that power, that they're all linked, they're all intertwined. And that's how we can shape and change the lives of those that are really less fortunate. So that's me in a nutshell. I will open it up to questions, comments as well. Did anything I say resonate with you? Or maybe it didn't. Maybe you're like, oh, that's a baloney. So I see there's a lot of people on, and only Mr. Liu has his video on. What is everybody else doing? We are all type A individuals, so everybody's multitasking.
Hi, Dr. Ali. Thank you so much for the talk. Perhaps people are just camera shy, or maybe they're having lunch right now. But
stuffed, I see that. Yes.
I did have.
Yeah.
I'm sorry. I did have a question. So you talked a little bit about how you're on committees and panels and some advisory groups. And I think this talk is very timely and very important because M1's had a presentation that we had to give about physician advocacy. So can you talk a little bit about disparity that you saw in your community and how you walked through it?
Yeah, so that's a very interesting story. And I'll tell you a little bit about my background to give you some context. So I grew up in Somerville, New Jersey, which, if you know the area, Somerville is not too far from the New Brunswick area, if New Brunswick is where you happen to be. And when I grew up, Somerville is sort of a small town. It has this sort of very traditional old world feel to it, but it's like 30 minutes from New Brunswick, 40 minutes from Newark. And growing up, I was poor, but it was so interesting because I was poor, but one of those poor kids that didn't realize I was poor. So grew up, had great family, friends, uncles, individuals that loved me, and individuals that told me I can do and be anything I wanted to be, right? And I went through life thinking that and believing that and knowing that to be true. And I also lived a time in Africa. So my mom moved us to Africa for about 10 years. So I lived in West Africa and I lived in Nigeria. And I came back to go to college. So that was a whole nother experience that reaffirmed me as an individual, reaffirmed me as a person of color and what I could do and what I could accomplish in this life. And came back to go to college. And even my college experience was very fulfilling and rewarding. And it wasn't until I got to medical school, which is interesting, that I then had my first awakening that, oh, people are treated differently because of the color of their skin. That, oh my gosh, people are treated differently because of how much they have in their bank account or how much they don't have in their bank account. That was a realization to me. And having grown up with my past context of being poor, but understand, because you're poor does not mean you're not loved, you're not wanted, doesn't mean you don't have aspirations and hopes. Also understanding that many of the individuals in my family, because we were poor, did have many of the ailments we see today. So that a person is not defined because they're diabetic. A person is not defined because they have HIV, as I had uncles who were homosexuals and contracted HIV and died. I had cousins who were incarcerated. So again, a person is not defined by their illness, is not defined by their circumstance. And so I understood that quite clearly. And so it was really interesting to be in medical school and for the first time have that awareness that people are not treated equally based on their economic status, their social status, or the color of their skin. And that never sat right with me. And so really early on, I was thinking, how do I make that difference? What's the small thing I can do? What's the small change I can make to make that better? Because that's the other thing, you know, my grandmother always used to tell me, is that if you want to see change, then you have to be the change. That you can't wait for anyone else to make that difference. You have to make that difference if it really matters to you. And small changes add up over time. And so when I was in medical school, one of the things we started was hip hop. I think it's still existing today, but I'm very proud to say that that was the program, along with Dr. Brenner, that I started. I know, that's Michael, yes. And that was one of the first things, because we went out to Chandler Clinic and we were like, oh, wow, they don't have, enough providers, but here we are students and we really want to get our hands in, we really want to see patients, we really want to make a difference. And so when I was a third year working with Dr. Brenner, we started that program, and now I believe it's baked into the curriculum. So again, small things make a difference over time. And so that is one way in which we are helping to reduce inequities and reduce disparities. So just this idea of whenever you see disparities, you speak out. And I think because of my past, I'm not afraid, I'm not ashamed to speak out. And the more you vocalize, the more you become known as the person that vocalizes, the more you become known as the person that speaks out, the more you are then invited to be a part of panels and discussions. Because if you're thoughtful, and if your intent is good, I believe people can see that. And so through time, again, not being afraid, not being ashamed to speak out about inequities, and be wanting to offer opinions and suggestions and guidance on how to make systems better for those that are less fortunate, I think is the way we sort of bridge that gap one step at a time.
One question that came in through the chat was, how did you learn how to write policy? Did you have any additional training?
No training at all. So it's sort of, yeah, I think now there are probably courses, everything you can probably Google. There's probably a course, it's on the internet. When I was growing up, yes, I sound like my grandmother. When I was growing up, there was quite no internet yet. We didn't have cell phones and we didn't have the internet. But yes, I'm sure there are courses on it and things you can take, but it was just trial and error. Quite honestly, it was trial and error. Take an old policy, look at it and say, what are the changes that you think you'd want to make to that policy? Talk with others that the policy is going to affect, which is always the key, particularly when you get individuals in a room that are really smart and think they know the answers. Make sure you take it to the individual that it's going to affect, to that community, and help shape that policy to move it forward. I see here there's another question about work-life balance. How do you handle managing work, advocacy, family, and personal health? So that is many years of, again, trial and error. So actually before I had my son, I would say I was a workaholic. And so at my health center, and then once I became chief medical officer, I probably worked 70 hours a week, easily. Wake up in the morning, work till midnight every single day. So there's no balance there. And it really was when I had my son and understood that I wanted to have quality experience with him. And that was, again, the awakening for me about how do I balance this? How do I still do the great work that I want to do, but really then how do I have quality time for my son and my husband? Probably my husband was very happy that my son came along, because before that, as I said, when he would ask me for quality time, I was like, yeah, we'll get to that. But so now it really is about being very intentional. And now we know really that striking that balance, the earlier you can learn to strike that balance is really important. And that all comes from intentionality, being intentional about, looking at your calendar and you're saying, I'm going to give myself 2 hours to do this. Or, I'm going to break this project up into, 1 hour increments so that I'm not stressed to complete it at the end of the week when it's due on Friday and I stay up all night Thursday because I'm going to do it. So again, it's just really being intentional about striking those balances. One of the things that you don't really learn in medical school is finding your joy. Finding your joy. And in doing so, you will then often find a balance. So for me, I really enjoy cycling. So I cycle in the winter indoors, and then during the summer months and fall, I cycle outdoors. I've done lots of cycling. We've gone across country to cycle, as well as in other countries. So finding your joy, and it seems like that should be an easy enough thing. And some of you may have things that you enjoy already, which is great. But then if you don't, then you've got to experience many different things. And in order to experience many different things, to find what brings you joy, you have to try many different things. That means you have to put time into it. So you have to decide, yeah, I'm going to run, I'm going to draw, I'm going to go to the movies, I'm going to read a good book, I'm going to try winemaking, whatever it is, to try and explore new things so you find your joy. And when you do that, then it's so much easier to have that balance between the things you enjoy doing and the work that you want to do in order to succeed and be successful in life. Now, sometimes the two are one and the same, and that was my problem, but also my reward, is that I really enjoy what I do. So when I spend 12 hours a day doing it, it brought me joy. It brought me fulfillment. And it took many, many years for my husband to understand that. And that he would say, well, why are you working on a Saturday? I say, why are you watching football on a Saturday? And he'd be like, I like football. And I'm like, I like what I do. Exactly. And so again, finding what brings you joy. And then from there, really that helps to create that balance in life. And in order to find what brings you joy, if you don't already know that, you got to have a lot of experiences.
Hi, I have a question.
Yes.
Hi, thank you so much for speaking with us. And I'm currently in 3rd year and having been very involved with hip hop for the 1st and 2nd year. So it's definitely an honor to be in the presence of one of the founders. Thank you for the legacy that you left behind. So as a 3rd year, just going through rotations, I feel like I have seen the side of healthcare that no one really talks about in the 1st and 2nd year. And I definitely resonated with a lot of the things that you talked about. And for me, long term, I do see myself moving towards an administrative role. So I was wondering, and I've been talking to a lot of physicians that are kind of like just like you, having like an administrative positions with health policy, and just talking about like an MBA. So in your journey, like, did you consider doing an MBA? Did you like encounter certain things that you thought, oh, perhaps like an advanced degree in like understanding the business side of medicine would have helped? I just want to hear your insight on that.
Yes, no, I definitely think that is very, very helpful if you know early on that you want to go into the administrative side of the world. I did go down that road. I think at this point I'm 6 credits shy of my MBA. So don't follow me as an example. If you start it, complete it. But what happened was I was with my son. I was pregnant with my son. So my last 2 classes I didn't finish because I delivered my son. And then I had my son and, the baby, and he's so beautiful and you want to spend all your time with him. And then I just never really had the the motivation to go back to finish those 6 because I had the knowledge. So that's really what I wanted and what I needed. So I had all the classes and organizational behavior and financial statements. I had all the knowledge. And since I also happened to be very comfortable in my organization, I never needed to, submit a resume and go somewhere else. Probably if I would have been thinking about that, I would have completed it because it's good to put on the resume. But really what I wanted was that knowledge, to your point. How do I, what are the skills, experience, et cetera, I need for administration? So yes, if that's something you're interested in, I would definitely recommend adding that to your toolkit.
Thank you so much. Sorry.
You're welcome.
I'm going to ask a question if that's all right.
Yes.
I just want to, hip hop is alive and well, and we found one of like the 1995 program manuals buried in the back of Chandler the other day. So both like a literal legacy and just little archive items stick around for sure. But I think this question sort of speaks to sort of the lack of the sort of like training we get at least in med school and probably in residency too. But can you just talk about the difference between like a CEO and a CMO and sort of what other sort of leadership positions there are in this space?
Yes, so there's so many different ones. So chief medical officer is where a lot of people land as physicians. And so as a chief medical officer of a hospital or an outpatient primary care practice or a doctor's office or a group of doctor's offices, the chief medical officer oversees all the clinical people. So all the providers, all the nurses, anyone who touches the patient, the chief medical officer oversees that. And by such, they hire, they create the policies for the department, they provide the strategic plan for that department, what services are going to be provided, what services are going to be stopped. And then they also work with the executive committee, the chief operating officer who handles the facility, the operations of the building, the HVAC, all those kinds of things. A call center, that's operations. You'll have your financial officer, right? That one's pretty straightforward. And then the CEO. So the chief medical officer will work in that executive suite, helping to strategize, to determine what's the mission of this organization. Where is it going to go? So not only does the chief medical officer oversee everything clinical, he or she is also a critical part of the team that plans and strategizes for the organization as a whole. So again, a lot of physicians naturally, if they want to do administration, gravitate to that role. But physicians can do the other roles too. So physician could be a chief operating officer. They could be a chief financial officer. Chief financial officer, again, that acumen, really a lot of accounting goes on, but if that person has that dual degree, great. And then of course, physicians can be CEOs. And again, so my road did go from a pediatrician to chief medical officer. And I was a chief medical officer for, again, about 6 or 7 years. And then I became the chief executive officer.
Thank you.
You're welcome.
Hi, Dr. Ali. My name is Maureen. I am a first-year medical student, and thank you so much for your introduction. I really appreciate that you're here. I actually went to the College of New Jersey, which is, so we have a really close relationship with Trenton, and then now I'm at RWJMS, so it's kind of like the inverse. But community service was a really big part of my college career, and that's what I aspire to make my medical school career to be about too, to include a lot of social justice. And so my question is kind of twofold. One is, are there any lessons that you've learned paralleling Trenton and New Brunswick, and like any specific concerns that you think medical students should really know about? And two, were there any mentors during your medical school career who really helped you pursue kind of that social justice and advocacy background?
I'll answer the latter part first. And I will say, I thought she was just on, but Patricia Whitley Williams was one of my mentors. And one of those individuals that was just just always warm, kind, down to earth, always willing to share, open up her thoughts, her experiences. And so that was great. And then also just it seemed to just be second nature for her to advocate for the well-being of every patient that she saw. And so again, that resonated a lot with me, as I mentioned, because of the background. I think in terms of the first part of the question, Trenton, I will say all cities that have real pockets and significant population of impoverished people share very similar characteristics, because I believe poverty in and of itself leads to many of the inequities and the disparities and the social injustices that we see. And I believe, as I was saying, that structural racism through the years has led to the pockets of poverty that we see, whether that's in New Brunswick or Newark or Patterson or Perth Amboy or Trenton, because of the structural racism that happens within those communities, whether it's inability to afford housing, inability to get a job, again, inability for a decent education. All of that's tied to structural racism within these communities. And therefore that breeds poverty. That poverty therefore leads to all the inequities we see. So again, there's many good examples. If you lift people out of poverty, oh, miraculous, they're healthier. If you lift people out of poverty, oh my goodness, you give them a good school system, they do better. Who would think, right? So again, if we could lift communities out of poverty, you would see a lot of the inequities, the disparities that we see, you would see them normalize. But that's a tricky thing to do. And how do you then, again, work with communities over time, wherever you can, to help reduce those disparities? And sometimes, depending on where you are in your thought and your career, it's one person at a time, helping one child, helping them, tutoring them, helping one teacher, helping one patient, helping one person at a time also makes a difference. And then as you grow in your careers, I found that was really rewarding to begin with, but then I wanted more. I wanted to help more people. And a way, again, in which to do that was really to be part of the individuals, part of the discussion that sets the policies, that reduces the structural racism within these pockets of impoverished communities that can then affect generations to come. Did I answer your question, Maureen?
Yeah, thank you so much.
All right, good. As you can see, once I get started and I'm like, oh, what was that question?
This is a kind of a loaded question that I saw come in, but what is your number one priority in reducing health disparities at your health center?
Number one priority. Oh, that's a good question, because I don't think if we have one. But right now, I will say it's really helping to empower our patients. And just that, empower our patients, because again, if you understand, when you live in a community that's been impoverished, if you live in the Trentons and the Newarks and the Perth Amboys of this world, generation after generation, you have a sense of hopelessness. You have a sense of, I don't have power to affect change. And so one of the things that we try to do is help our patients understand that the power is theirs. And I think we've even seen that translated through our communities overall, right? With the past summer and the death of George Floyd, and individuals understanding, no, I may be poor, I may be of color, I may be an immigrant, but I do have some power here. And so one of the things we've been doing is, how do we inspire people to understand that? Because when you understand that, then you realize, no, what I do does affect my health. Because many times what we see, particularly in communities that are impoverished, that are disenfranchised and have been disenfranchised for generations and decades. And this is something that it took me a while to understand, and I'll backtrack a little bit, is that when I was a pediatrician, I would see families, they would come in with the moms, the children, the grandmoms, or the dad. I'd take care of them. I'd give them a prescription. Let's say somebody has asthma, and the mom wouldn't get the medicine. Or I'd send someone, I say, you know what, you've got really bad asthma. You need to go see a pulmonologist. And they wouldn't go. And you're like, wait a minute, that doesn't make any sense, right? Because you came to see me, and obviously you wanted your child to get better because you came in. If you didn't care, you wouldn't have come in. So that myth about people just don't care about their health care is a fallacy to me. Because if you didn't care, you wouldn't have come into the health center. You wouldn't have brought your child in. So you do want them to get better. But then why didn't you do what I asked you to do to make them better? And when you understand the answers to that are all tied with living in these toxic environments, these traumatizing environments, from the poverty, from the disenfranchisement, and all the interplay between that, you understand that the answer is just not so simple as giving someone a prescription. And that really helping people to understand that they do have the power to affect the course of their lives and the lives of the ones they love is really what we need to do. And that's a big ask. That's a big task. And it's the journey we've been on in our health center. So it's more than just giving a prescription. It's more than just giving a referral. It's more than just doing a consult. When you really want people to be better, particularly people that are vulnerable, people that have been disenfranchised, people that are in impoverished and toxic and traumatizing communities, then you have to help people understand the power they really do have, because that's been taken away over generations. And part of that is weaving in also behavioral health. So behavioral health is a big part of our organization in terms of helping people to understand the power they have in making decisions that affect their lives and the lives of those that they love. So again, I know that wasn't a simple answer. Hopefully I answered it well. Anything else? I'm thinking, is there anything else I'd like to share?
Something else that came through on my end was if there's any skills that you recommend students pursue to transition into a leadership role.
Well, one, I think being very insightful about yourself, because in order to connect with individuals, you have to feel very comfortable with who you are, what you stand for. And I often say, I think that is more important than the knowledge that they cram into us in those first 2 years. I really do, because I've seen lots of people, the brightest people in the first 2 years, that quite honestly make the worst doctors. And I've seen people that struggled the first 2 years to remember all the things and make the best doctors. And so really the skill set is about how do you connect with people. And there's also a lot of research behind this, that the physicians that connect with their patients are also sued less. So that's another good reason to do that. So again, how do you connect with people? And one way to connect with people is you have to know yourself. You have to feel really comfortable. You have to feel really confident with who you are and what you stand for. So again, when I walk into a room with a patient, I'm always like this. I'm genuine, I'm down to earth. I see every patient, no matter their color, no matter their background. I think this could be my mother, this could be my son, this could be my husband, this could be my aunt. And how would I want that person treated? How do I talk to that person so they really understand? I know, again, and because I have that background, I told you about, my family was poor. They didn't understand, you know, when they went to the doctors and they came out what the doctor just said. And so always thinking like, how would I say this to my aunt so she really understood? You know, don't use cardiologist, say the heart doctor. You know, so just real simple things about wanting to make sure that you are connecting with the person in front of you and it feels genuine. And when you're confident about who you are and what you stand for, it's easier to connect with individuals. But that connection piece is really important, as I said, because I firmly believe that's how patients are healed. That's how you give patients back some of that power. And then, as I said, it's also providers that connect more are sued less. So that's also a good thing as well. I think the other skill set that's really good for providers, probably no matter where you go, unless you're going to do research or something like that, is understanding, you know, how to bill. A lot of places never teach. I don't know if they do now, but it was never taught in medical school, never taught in residency. And day one, when you're finished, right, you leave residency, what is it, June something, and you start in a new job, maybe take 2 weeks off and you go in, the first thing they're going to want you to do is bill. They want you to make money. And we've had no training, none whatsoever. So that's the other skill set that you will probably have to learn on your own. But it's something that no one ever talks about. It's like, shh, doctors make money. Well, that's what we're trained to do. So again, I definitely recommend that it's something that you learn before you really go into your job. Again, unless you happen to go into a job where you're not billing. So if you're going into administration or you're going into clinical research, which some physicians do, or you're going to be a sports medicine physician, or some a role where you are not billing, but otherwise, really learning that skill set and learning it well is good and handy. But those are probably my two pearls.
Thank you for coming, Dr. Alli. So I have a question about the MBA degree. I heard your discussion about it, and I'm not really sure. I know I want to do something else than becoming a clinician, either working out working in a CMO position, or starting my own practice, or even working at a medical school. I don't really know, but I know I want to do something else.
You got it.
And I'm curious, like, when is the best time to get your MBA degree? I know a lot of people get it while they're in med school, or potentially during residency, or while they're attending. And the only reason why I have this question is because I'm wondering if I get it during my time during medical school, or even during residency, when obviously I'm very busy, how can I implement what I learned during my time in school as a medical student or even as a resident?
Yeah, that's a very good question. And I don't think there's any right or wrong answer. I know people that have done it all throughout their careers. I know people that have done it during medical school. And I have to say, thinking back, they didn't offer that when I went to Rutgers. But if they did, and I could have gotten a combined MD, MBA, I probably would have. I will say it's like everything else, right? It's like my son says, Mom, why am I learning geometry? I'm never going to use this again. I'm like, no, you'll remember the core principles. That's what it's about. You'll remember this topic and then you'll go to the book and you'll pull it out and you'll refresh yourself. But you'll at least have that knowledge that this topic, this issue exists, and you'll know where to find the information. So, right, I don't remember everything that I learned, because even I learned it like 10 years ago, but I know that there's something called organizational behavior, and that affects my organization, that organizations are like living, breathing units. And if you want an organization to work well, there are behaviors that you want to foster and behaviors you don't. And so I know that's a thing because I learned it in MBA when I was going to school, and then I can read more about it. So you're right, everything you learn, you're probably not going to remember, but you'll know it exists and you'll know that you can find out more about it. So whether you do it really early on, or to your point, like when I did it, it was after residency. You know, as I said, it was it was after residency, and then I was having my son. So it could be done any time in between. Now, I do know one or two people that did it during residency, but I would say those people are a little self-traumatizing. Because I don't know how you do that. That's a lot. That's really, really a lot. But I do know if you have that personality, if you're single and you know you don't have any other responsibilities, you probably could accomplish it if you do nothing else except go to school and go to work, go to school and go to work. But that probably would be a lot. So again, either doing it, I would recommend, as you said, either doing it combined with medical school or doing it once you finish your residency.
Thank you.
You're welcome.
Do you still see patients, Dr. Ali?
I don't, and that's only been over the last, I want to say the last 4 years. And that's only because there's so much I want to do. There's just not enough time to fit it all into the day. But I think for me, I'm very fortunate that I work in the same health center that I've always worked in. So when I come in or when I do my rounds, I see my patients and I get the luxury of seeing them but not having to take care of them. So literally just yesterday, I was walking through the lobby and I met a grandmom who I used to take care of her son. So it was the son and the grandmom, and the mom, the mom was out of the picture, the dad was out of the picture. The mom had a history of drug use. And so the grandmom, as often happens, the grandmom was the primary caregiver for the grandchild, and she would bring him in, and she's the sweetest sweetest lady. And she is the tiniest thing. If she is 4'8", I would be surprised. Tiny little thing, but I mean, amazing. So warm, so caring. She'd bring him in for all his visits. Noel was his name. And you know, over time, you bond, right? So I have lots of patients that I would say I love, that I really care about, and he was one of them. And so I just ran into her yesterday. And she says she wanted to, and she recognized me even with the mask. And she said, "Hey, are you Kemi Alli?" I was like, "Yes, I am." She's like, "I'm Noel's grandma." I'm like, "Oh, that's right. I couldn't see with the mask and everything." And she says, "He is doing so well now. He's married. He has his first child. He lives in Florida. He's coming back." And so it's like moments like that that are just so immensely rewarding that I don't need to see patients to get that, but probably it's only because I work at the same place I've always worked that I still have those interactions and those rewarding moments that you often get when you're treating your patients and you come to know, respect, and admire them. Great questions.
Any other questions before we close?
Hi, I have a quick question for Dr. Ali.
Yes, sir.
I wanted to know if you ever, when presented with a new problem in your center, have a difference of opinion between your pediatrician hat and your CEO hat, and how you remedy that.
That's a very good question. I don't think so. And I think because they're both in my one head. But I will say, I think that makes me think of, do I ever have a difference of opinion with my chief medical officer and what I want to do or what I think is best? And that's interesting, right? Because I was the chief medical officer. So I have that perspective, I have that understanding, but I also have the larger view, right? So I will say, I try to, as best as possible, always think about what's best for the individual patient. And as long as that doesn't contradict what the policy or the rule or the regulation is, then I move forward. And I also try to surround myself with individuals that don't necessarily think the way I do, which is in a way is a little counterintuitive, because we tend to gravitate to people that we know, people that we like, people that are similar to us. That's human nature. But I try to be very intentional about hiring people that are not afraid to speak out and not afraid to be different and give you that different opinion, because it is through that you grow. It's through that we improve. If everybody thinks the same, everybody does the same, then you stay stagnant. So in that regard, I'm often having conversations with my chief medical officer about, well, she thinks this and I think this, and where do we compromise? Always with the idea that we want to do what's best, not for the whole, because I'm not a big proponent of, do best for the whole and sacrifice the few. I'm not a proponent of that. I'd say, let's do what's best for everybody in the best way we possibly can. Right, so that's where we strike the balance. Thank you. That was a great question.
Thank you for your answer. And I have another question if nobody else has a question. I wanted to get an idea of how things were at the beginning of the pandemic, and how your role maybe changed and what your day-to-day looked like in terms of coordinating your team and ensuring the best practices were put forward.
Yeah, another excellent question. So I think when the pandemic first started, right, nobody knew what was going on. Nobody knew how it really infected other people's, right? It was like, I have a story. I was wiping down my groceries, I'm sure, I don't know if you guys were, but definitely I was, and my son was looking at me like, Mom, you are not well, as I was wiping down the egg carton. So when it first started, right, we really didn't quite know how it infected other individuals. And so one of the first things we did early on in our health center is we went to telehealth, all telehealth. So we closed all of our sites, and we helped our patients work through getting access so that they could use their phones, they could use their mobile devices, they can use their iPads, etc. Being very cautious about the digital divide, right? Particularly when you're in impoverished cities, and really helping patients work through all of that. So that was the first big change, is that everything went remote, right? So if it wasn't pandemic, I'd probably be with you guys, right? We'd be in a conference room somewhere. So that, that really has been a change. And then I think along with that change, not only have our patients experienced it, but probably you guys have too. And I know in our organization is this sense of isolation. And how do you then, for an organization and for your patients, how do you reduce that? How do we stay connected in this virtual world? Because as human beings, connection, as I was saying, is really important to us. And the people that do it better succeed more often. So it's a skill you can acquire, but that connection piece is really important to us as human beings. And so then how do we do that in this virtual world is something we've learned over the course of this year. So it's something we're helping our patients through, because they also feel very isolated Can you imagine if you're elderly, if you're alone, if you're living in an apartment building, and the one way in which you were connected is when you came out of the building to, get your groceries, go to the doctor's office, those kinds of activities. And now that's all reduced. So really helping our patients through that. And then again, same thing with their staff, doing lots of activities, learning about lots of activities in terms of how can we stay connected, even though we're in this virtual world. So one of the things I do is I do something like this once a month, and we just don't talk about work. So for 2 hours, we have a virtual happy hour, and we play games. Can you imagine it? I play games. We play games, we laugh, we joke, and we just don't talk about work. And again, that was really important during the winter months when sort of we were at the height of that pandemic, and you couldn't go outside and you really couldn't do indoor activities. But again, how do we stay connected? And I think that is something that, to your point or to your question, we will take away from this idea that connection is really important. And how are we intentional about maintaining those connections no matter what happens? I do think it's changed the way organizations work. It's changed our organization forever. And I think no matter what happens, even if we go, what I believe what will happen is we will go into a hybrid world. Like I don't think we'll ever go back to just being in the office 5 days a week. Number one, it's been shown you don't really need to. People are just as effective as they were, but that connection is important. So maybe you go in 1 day, 2 days in order to have that connection. So what is this new hybrid world going to look like? And that's something we're thinking about right now in our organization, but that connection is really important.
Thank you so much for your insight.
You're welcome. Thank you for the question.
Anything else? Well, thank you, Dr. Ali, for being with us today.
Welcome.
People ask great questions, and I hope that you enjoyed it too. And for students, I will be sending out Dr. Ali's contact information so that you might be able to connect with her after the event. And thank you so much, everyone, for attending and for your engagement.
All right, everyone. Be safe, be well.
Thank you.
All right. Bye.
Thank you.